Welcome back, everyone. I hope you enjoyed your lunch and met some new acquaintances and caught up with some older acquaintances, as I did, some familiar colleagues from my past. So now please take out your raffle ticket. Here we go. Okay, again, the last four numbers. Those numbers are 2246. So close, so close. 2246. Oh, going once, going twice, 2246. Here we go. Oh, let's try 2247. Somebody get it? Yes, excellent, yay. Your name is Kyle? From who, where? Okay, so that was Kyle from UTHealth. All right, well, congratulations, Kyle. So next, we're going to dive deeper into the impact of zoonotic diseases on livestock and food safety. As our next panel makes their way to the stage, and I have some extra waters for you guys. I am delighted to introduce our next panel moderator, Dr. Blake Hanson. Dr. Hanson is an assistant professor in the Department of Internal Medicine, Division of Infectious Diseases within the McGovern School of Medicine, and he serves as the Associate Director for Microbial Genomics in the Center of Antimicrobial Resistance and Microbial Genomics. He is trained as an epidemiologist and has extensive experience in applying advanced genomic technologies and big data analytical methods to investigate infectious diseases of public health importance. Dr. Hanson's laboratory uses a combination of existing and innovative laboratory techniques and cutting-edge sequencing and bioinformatics to study infectious disease transmission and colonization, along with many other important and interesting things that are listed on his bio sketch, which I'm not going to read the entire thing because he is quite impressive, and we're lucky to have him. So please join me in welcoming Dr. Hanson.
Thank you for that very, very nice introduction. So before we get started into the questions, I'm going to ask the panel to go down the line, introduce yourselves, tell everyone a little bit about what you do and why you're here.
Sure. Hi, everyone. My name is Anabel Rodriguez. I am a field occupational epidemiologist. I'm also an assistant professor at Texas A&M at the department. I know. So I just changed though, and I've been teaching, and I've said, I spent a couple years at UTHealth Houston, and I got hissed by students. It was the weirdest thing. Yeah. Yeah. Anyhow, a lot of the work that I do focuses on occupational health and safety, predominantly among migrant farm workers, and in particular now for this panel, dairy farm workers. So hopefully today I'll be bringing in the perspective of ag workers in the H5N1 outbreak. Thank you.
Good afternoon, everyone. I'm Dr. Abdul. I'm the regional zoonosis vet in the Panhandle. I don't do what Anabel does. I do a lot of other different things though. But we have worked together with occupational health and safety in regards to like tuberculosis in the past. So I'll be bringing in that perspective with H5N1 for you guys today.
My name is Kenneth Davis. I'm the manager for the foodborne, waterborne, and high consequence infectious diseases at the State Health Department. I've been studying and being an epidemiologist for foodborne diseases for coming on my 15th year now. So I have a lot of experience from doing case interviews to working with the CDC and FDA and all of our other three-letter agencies. But That's it for me. Thanks.
Cool. Three-letter agencies. You can't tell us. So Tim Stevenson, a veterinarian, practiced down in the Texas City area, just across from Galveston, kind of like back home. And then felt like God was leading me into the Army. So I joined the Army Veterinary Service, served there for 29 years, working with public health, zoonotic disease, food supply systems for the Department of Defense. Then since I retired from the Army, I came to work for the state with consumer protection. So we have meat safety, food safety, environmental safety. We have the folks that I work with also do the dairy program, thus H5N1, and I'm excited to be here for all of you. One thing with Dr. Vigilant was here this morning. I see him there, esteemed colleague, 42 years. I can't match him. I'm close, but I'm more excited about the young faces around the room and the next generation, and hope that this time will be meaningful for you.
Awesome. Well, thank you very much. And I do want to make sure that we get this opened up to all of you so you can ask questions of the panelists. So start to prepare your questions as we go. But we're going to start with a few that we have already prepared just to be able to kind of get the conversation flowing, get us all into the routine before you all surprise us with whatever difficult questions you've got. So the first kind of question that we have that was given to us was, how do agricultural and public health agencies monitor livestock for potential foodborne pathogens? And what surveillance systems and regulations are in place to protect agricultural workers and consumers from zoonotic disease? So Dr. Rodriguez, if you want to start.
Yeah, I think I'll start with the second half of the question about ag workers, which is great to start with because it's often common. The part that we forget is that there are people working with animals. There are individuals who are waking up at the crack of dawn to work and to make sure that we eat our scrumptious food that we had today. And I think it's important that we go back a little bit before we go into basically the answer to surveillance is no, there isn't a form of surveillance for dairy farm workers. The surveillance is the ER room, basically, like a lot of us do, going in there, they'll test you for things, and then public health departments will be notified if it's a notifiable disease. But a lot of the problems with this is that there are so many vulnerabilities among ag workers, a lot of them being barriers to access to health, right? And so most of them will not be going into the ER. So a lot of it will come from boots on the ground vets, which I'll pass on to Dr. Cherissa about. So that's the first thing to consider on the ag worker side, their vulnerabilities, their access to health, and the barriers that are involved with it. But as far as an SOP and something that is in line for surveillance, there isn't.
So to follow up from what Dr. Rodriguez just said, the veterinarians aren't the surveillance systems, but they are the individual that's in between protecting human health from animal health. When they're on the farms and they're working with these animals, they're exposed to the same pathogens as the employees are. The difference is that they're trained to identify diseases and therefore help to prevent transmission between animals, but also to people. So they have that skill set in place that they identify many of times zoonotic diseases, which was very integral when it came to H5N1. It was the veterinarians, the dairy veterinarians working on these farms who had that really deep gut feeling, but also they noticed employees walking around with wild red eyes that made them presume that there was probably some zoonotic transmission going on there. So they are the boots on the ground. Like in school, they called us, we were like the frontier veterinarians, because we are the individuals that are there to protect public health, human health, and animal health.
Dr. Stevenson, if you want to jump in and talk about the consumer protection portion as well.
Yeah, of the surveillance part. So it's interesting. I'll start with one little story about public health and kind of how I got a little bit interested in this. First year veterinary school, one of the classes they teach is zoonotic diseases. You learn quickly what that becomes, and now it's big talk of the conference here. So many diseases that we worry about in people literally are zoonotic. Ebola, it resides in animals somewhere as the host and then spills over into humans. So many of those diseases are like that. And I remember the first semester in veterinary school, I came back at Christmas and my dad said, say something in science. since I've been studying veterinary medicine. And I said, well, we had this fascinating class as public health. There's all these diseases you could get from animals. And you could see we just finished eating, and you could see the color just came out of his face. And my mother's sitting there, and they're like, my goodness, that's horrible. Well, what do we do? And I said, I don't know. We'll learn that next semester. So the idea, identifying diseases, and it is a lot of what we study in veterinary medicine. We always think of dogs and cats. Most of us, if you think you're a veterinarian, you think about dogs and cats across the table and birds and those sorts of things. But that's a lot of time our exposure. But when it deals with farm animals and when it deals with the food supply, a background of disease knowledge and knowing that, hey, these particular diseases can go to people become incredibly important. And that's a lot of what we do with our consumer protection group with the State Department of Health Services. We have the meat safety group that does inspections at the slaughterhouse, very similar to what U.S. Department of Agriculture Food Safety Inspection Service does in other meat plants, especially if a meat establishment is going to sell across state lines or internationally. It must be inspected by a federal agency. There are some cases where the state inspection agency could do those on behalf of the federal agency, but the state programs typically work with products within the state. And then with Food and Drug Administration, so both food and drugs, we have federal counterparts that tend to set standards across state lines and internationally. So that's a part of what our team does with the state. A lot of our state programs develop equivalencies with federal agencies so that when it comes to food inspection, if this bottled water were bottled in Texas, but you want to sell it across state lines, we have criteria that are national for the analytes and the heavy metals that might be in the water, pesticides and things like that. So standards so that you don't have to find 50 different kinds of bottled water in the United States. We have a federal standard. Many times those inspections and standards are upheld by state programs. So I'll pause for there. And if we have time later, we can always talk more.
Always come back. Perfect. And I do want to circle back to just one part of the question, which is the aspect we talked about the surveillance component, but there are other kind of physical protections that are involved for protecting our livestock and protecting our livestock workers as well. And so, Dr. Rodriguez, I was hoping you could tell us a little bit more about the physical protection and kind of personal protection pieces that are available.
Yeah, so we have something we call the hierarchy of controls. And I think some that we see the most, right, which is at the very bottom of, if you're imagining a pyramid, is PPE. And so this is something that workers can have access to in some places of employment. Now, them using it correctly or actually using it at all is another story. I know for this particular virus, you would need a respirator, but you cannot wear a respirator when you're milking cows for 12 hours. And so they rely on gator masks that they'll put over their face and some glasses. I was just on a farm last week in New Mexico, and we were doing a study in the parlor. I mean, it's just splatter of milk and feces and urine everywhere. And so it's very, very hard to completely protect yourself. But that's kind of the first line is PPE, administrative controls that are done across the farm, and then engineering controls, which could be your biosecurity, which is not something that is enforced as strictly as it is in the poultry industry, right? Where workers wash in and wash out, workers in the dairy farm are not washing in and out, right? And at times they might be taking some of their clothes back home to their families or where they live in crowded conditions with other workers from other industries, which is another aspect to consider.
Thank you. And I think that's an important piece to kind of discuss is that this is where this vigilance and kind of access to public health and public health care is so critical for us, because there are a lot of ways for these pathogens to be circulating within the population of animals that we have within our human population and our community. And that zoonotic spread, which is the reason we're all here, is really sitting at that nexus. And so understanding these barriers, understanding the challenges and the realities of what actually exists on these farms is critical to being able to design kind of intentful and applicable, kind of appropriate methods of control and care for the workers that we have and the animals that are there. So I think with a slight transition here, and it's kind of take what we've already talked about and add a little bit of a flavor to it. I'm sure one of the things that everyone has been paying attention to this spring and the summer is H5N1 and H5N1 in cattle in particular. And so we'll come at this a few different ways. But as with what we talked about, I'm going to bring some different people in and also talk about a few different pieces that are here. And so I think first and foremost, H5N1 is a pathogen that we've had around us for a very long time. It's been actually causing high pathogenic avian influenza since the 1990s. We've seen this circulating in waves in agricultural populations, such as our poultry populations. It's caused outbreaks internationally, and we've now got this in our livestock populations and in some poultry populations within Texas, within the United States, and abroad as a large number of different places. And so one of the questions that we received is, as the situation with H5N1 influenza continues to evolve, are we especially concerned about transmission within specific agricultural settings, or are there specific workers that may be at higher or increased risk? And I think this is an incredibly critical piece, because when we think about our current spread, we're currently seeing it in poultry, primarily in chickens, and in our cattle. And cattle is new. That is not a specific mammal reservoir that we thought was even able to be infected by H5N1 influenza until this year. And so we start to think about risk, and risk to our workers, risk to our community, and to the agricultural process themselves, the animals that are there. Cattle is a marker of a new jump to a new species that we weren't expecting. But I think there's other kind of concerns that want to bring into this, and then I'm going to hear from the panel on what you think about this as well. And so I think first and foremost, looking at cattle as a marker of one of these species, the next one that we need to be thoughtful about is swine. So pork production, swine, pigs, and that's been traditionally thought of as a mixing vessel for influenza. They have closer kind of biological signatures that we do as compared to cattle does. And so if it gets into swine and is able to move and adapt, that's another concern that it may jump into humans and be able to cause lasting infections and lasting kind of transmission. So these are concerns that we have to have. But I think the other piece I want to bring in is that we often think about agriculture and agricultural workers as these larger farms and larger facilities, but things like backyard flocks of chickens can also be a large contact point between the people that are maintaining that chicken flock and the birds. And we often see that those little backyard populations can be positive for H5N1, particularly in international settings. And that is a potential contact point for transmission into humans. And so as we look at this, I just want to hear if anyone can volunteer into this, but what do you all think about the risk in agriculture and how we're thinking about and changing the way that we're looking at this risk with the new emergence of H5N1 in our cattle populations?
So just to follow up with what you were saying, yes, having the different species of concern, pigs are a big concern. They've always been a concern. From the time I was in undergrad, pigs were a concern for avian influenza. So that's not a new concern. I believe what we should be thinking about or even considering is that we're seeing things we haven't seen before. That's where your mind should be sort of churning when it comes to topics like this. We're seeing things that we never thought were possible. Avian influenza in a cow. I remember when I heard that the first day, I had to sit down because I was like, I didn't hear that right. And they repeated it. And I was like, yeah, I did. Okay. I need a second to let it sink in, right? So we're seeing more of these novel pathogens as is been described in the textbooks for many, many years. But we're also seeing the reemergence of diseases as well. So although, yes, we're concerned about the swine population, they do have really intense biosecurity protocols, and they're already ramping up their biosecurity protocols in preparation for what they hope will not happen, but it's possible. From my perspective, working on the side of public health, we're looking at what's happening with the animals, but also transmissibility to people. What we've seen is not just about the animals, it's the population that's serving the animals. So we're talking about the employees. Like Anabel mentioned earlier, we have a demographic of employees that are really underserved and they're unrecognized for everything that they do and the conditions that they live in. So when we put a population that doesn't have access to healthcare, doesn't have the finances to access healthcare, I'm not sure what their nutrition status is at, but we know all these things play a role in health. We can also throw in there their immigration status. That also plays a role in their ability to take care of themselves. So when we're putting a population like that in a situation where we're dealing with novel pathogens, we have a big problem looking at an underserved area like that. So yes, the animals are a concern, but what about the people? Because if we're concerned about transmission to people and subsequently human to human transmission, we need to look at the population that is mostly at risk, which are the workers on these farms, and try to mitigate spread that way. We know how to prevent spread in animals. Veterinarians, I'm sorry, we're pretty good at what we do. Just putting that out there. So we know how to handle these situations. That's what we're trained for. From the very first day in vet school, like what Dr. Stevenson mentioned, that's what we're trained to do. But now we need to cover our vulnerable populations where the risk of transmission is very high. And that's what we're looking out for with H5N1.
Go ahead.
I'd like Dr. Abdul to talk about what happened with cats on the farms when early on with the H5N1 coming to the farm.
Yes, so, well, that puts a whole new demographic of people at risk with the cats. So, the veterinarians are noticing we have sick cattle. And for those who don't know what was happening was initially it was a massive drop in their milk production. They went from producing however many gallons they do a day to what we would call just drying up, right? And their mammary glands literally look like they deflated. So they went from balloons to empty balloons. And so that's what they were noticing. But simultaneously, now they're seeing, hey, we're seeing dead birds, or they're hearing reports of these dead birds occurring on the farms as well by the employees. And when they ask the employees, what were the birds doing? Or what were you doing when you saw the birds? Because the birds aren't there anymore. Well, we picked them up. We bagged them and we trashed them. No gloves, no mask, no PPE. They were trying, with the cats, they were noticing the cats weren't acting right. And we hear that a lot, even in a clinical setting, right? They ain't doing right, that the ADR. So this is what the, employees are reporting to the veterinarians. And what was wild with the cats was that the cats seemingly disappeared from some of these farms. But for the cats that were around long enough for the veterinarians to observe them, they were neurologic. They appeared to be blind. They wouldn't move from where they were laying or, hunched down, like how cats do when they're really feeling crummy. And they don't care if you're a familiar face or not. That's how you know a cat's really sick, especially a feral cat. If it will not move when you touch it, don't touch it anymore. Call someone else. Okay, so it's hunkered down, not moving, and it appeared blind. Some of these cats were tested, and these cats were on the farms, and they came back positive. They had a meningitis. So when you think about these cats were handled by the employees as well, because they're concerned about the cats. These were like pets on the farms, and they're handling them, bare hands. They're concerned about the health of the cats. They're concerned about the health of the birds. They're concerned about the health of the cattle. And yet they are not concerned about their own health necessarily, because they're putting themselves in these situations, trying to help the animals without understanding the severity of what they were actually being exposed to. And so with the veterinarians there submitting all of these samples, yes, we came to detect that H5N1 did indeed affect cats. But cats weren't the only mammals affected in the panhandle. We had a skunk the year before that we thought was rabid because, we got a lot of rabid skunks up there. And that came back negative. But then lo and behold, because it was found in an area where there was a bird die-off, it was tested for H5N1 and came back positive. So the question is, well, how many other skunks or wildlife for that matter actually died from H5N1 prior to us detecting it in cattle? Because for any of y'all who live out in the hinterlands of Texas, in the panhandle, right? Common practice is if that animal isn't acting right, it's put down and not necessarily tested any further for anything. So how many of these neurologic animals were put down and just left out that could have had, rabies is bad, but in this situation, H5N1, for instance. So that's something that within our region that we're trying to heavily make the effort to educate our veterinarians and our animal control officers to monitor for that, right? We don't just want to dismiss it because there weren't any human exposures, we need to know what's out there. And by knowing what's out there, we can then further help or at least give these recommendations and advice to our providers what they should be looking out for because we know it's there because we found it. I'll stop now.
Yeah, no, I just want to add to that. I think there's a piece also of education that is needed. Some of the earlier calls, and I will not say dates in particular, with some of the workers in the Panhandle was that they were truly concerned about the health of cattle. Again, not concerned about themselves, right? With cattle, you can scan their ear and you'll know from the day that, that she was born all the way until the present day. With workers, we have no idea. We have not done our due justice, right, in that area to really serve the workers who are feeding us. But to go back to the conversation I was having with this worker was that they were all concerned that they had done something to the cows. They were like, they're all sick. There are, like 10% of the herd is in the hospital. We have no idea what we did to them. And, they're not eating, they're not drinking water, they're not producing. What do? We're scared. But there was never this risk on themselves. And so that's another piece I think that is really needed for this particular population is the education on H5N1, but also how to prevent it, how to mitigate it, but how to identify it within themselves and to care for themselves as well, not just the cattle.
Right.
I think that's a fantastic transition to kind of the second half of this question, which is how has monitoring for H5N1 changed over the last 6 to 8 months? And so I think taking this from multiple different perspectives, let's start with just the agricultural workers. How has testing and monitoring for symptoms, different pieces changed over that time frame now that we know that this is circulating?
Yeah, I mean, we need buy-in from producers and from the industry. That's number one. I don't think we can do it without them because it's a private business and we would have to go in there. Now, getting the workers out to a place where they can test them is another thing. And Cherissa said it well, right? There are so many health barriers, systemic health barriers in this area of not only being rural health deserts, but individuals not knowing where to go, right? They're very transient populations. They don't know about the healthcare services in their area. And this is the plug that I'll put in for TEPHI, that we created some resource lists that we've been disseminating in this area that have all that information so that if they're new to the area, they're able to go. But the likelihood of that happening, especially in this type of environment and them being scared of law enforcement and deportation agencies, it won't happen. And so we need to go on the farm, test workers on the farm, involve the producer, and also work with vets to be able to match the epi on the cow side to the human side. Because I think one of the things, this is some of the line of work that I do, is trying to match the particular job tasks that are associated with the highest level of infection. I mean, for this particular one, I'll tell you, milking, number one. Second, hospital, because you're working directly with the sick animals. And so it's identifying those epi methods that I think will lead us to a better understanding of the bigger picture.
I think kind of and I'll ask if you agree with this statement. So it sounds like a lot of this is communication and partnership, right? And so a lot of what we have in the response is kind of a fear of punitive aspects of this emerging pathogen in these populations. And from a public health effort, that's really not what we're trying to do. We're trying to understand what is circulating in this high-risk population, how they may be encountering and being infected by this pathogen or any emerging zoonotic pathogen, and how we can then intervene to prevent that outbreak from happening and prevent that from jumping into the wider population. And so I think, let me know what you think, but this is where TEPHI comes in and creating these partnerships, creating these large strengths. And this is where public health veterinarians, all these individuals that are our frontline workers or our frontline contacts really are trying to create these really strong relationships to make sure that it is a helpful, productive kind of relationship. It is not meant to be punitive.
Yeah. And I think sometimes we are stuck in our silos and are not talking to one another about it. But I think, what I do the worker side of this, but I understand the producer side of it as well, because it's their business. They've been in there 5, 6 generations of farmers. And sometimes they are these bigger entities, as you were saying, they're not the mom pop farms that we used to see in the 80s and the 90s. Now these are much bigger, and I will have my hands slapped by saying this, enterprises, right? But that are still acting like a smaller farm, that are not putting in some of these biosecurities or even allowing outside entities to come in and help them out. And so it's a catch-22 situation. It's difficult, but I think these partnerships are the most important thing that we can do so that we are all talking to one another.
Yeah, I think in veterinary school, they teach us if you hear hoofbeats, don't look for zebras, you know. A zebra could be a zebra, but typically it's a horse or a cow if you hear hoofbeats, you know, in Texas at least. So these diseases, it's novel disease. We've had influenza D in cattle, dairy cattle, but not influenza A. It's not the first thing that anybody's going to jump to. Let's take a step back just to foundational disease transmission and control in the veterinary community, in the livestock community. There are a list of diseases that are nationally known in the U.S. Many of the time we call them foreign animal diseases because we don't have them here. How nice, so like we were talking about mosquitoes, that they don't just stop at the border, right? Diseases don't either. Other people call them transboundary diseases. They go across boundaries, but for many of those we don't have in the United States. We don't have, foot and mouth disease, for example, is an incredibly horrible disease with livestock because it goes to cattle, sheep, pigs. It really decimates production. It spreads very readily. It's hard to vaccinate. Vaccines are not very effective. You need a vaccine for that specific type of the foot and mouth disease. So that's a disease that scares all of us. We don't have it in the United States right now. If a veterinarian or a farm worker were to find vesicles in an animal, that's a typical sign, vesicles in and around the mouth or along the hoof line, then there are other diseases that look like that. There are also vesicular diseases. So immediately the red flag goes up. We take samples, we send that to the National Animal Laboratory Health Network. There's a state version and then a national federal version of that. That's the way the samples flow. So that's the typical structure for those known diseases. You know, responding to novel diseases, it's always that challenge. How far forward do you lean? If you lean too far forward, you fall on your face, right? If you overreact to every disease you see, you lose trust with the producer, with the producers, with those other stakeholders. You decimate business and sometimes unnecessarily. Here's a real example in this case. One big meat producer, I'll leave the name out, stopped buying dairy cows from Texas because they heard there was something. This was before it was diagnosed as avian influenza. They stopped buying dairy cows, you know, for the meat market. So they reacted in that way. You know, it turned out they probably didn't buy some cows that might have been subclinical or may have had disease. But if everybody reacts when they hear something, it's incredibly bad for the farmer. They lose their livestock. Imagine if you're a dairy producer and you got monthly bills and the co-op quits buying your milk. How many months could you survive buying feed for the cows, water, electricity, and now they're sick, so you're trying to treat these sick cows, your veterinary bills are going up. How many months could you last? Not long. And so they need to be able to keep the healthy product going into commerce, and thankfully pasteurization works. We knew it would by indirectly, but now we have specific evidence that we know it's effective. So that the product can go into commerce. That's good for everybody. If we get a milk crisis and the price of milk, cheese, yogurt, cream goes, doubles and triples, that's not good for consumers either, So trying to weigh those things and just really working to maintain trust, react as appropriately as you can with the scientific information. It's hard to go out on a limb on a hunch. So, and again, hindsight's much better than foresight, looking back on these sorts of things, but just trying to maintain trust with the producer, with all the stakeholders. when I was in the, working with the Army, I worked a lot with federal counterparts, so USDA, FDA, federal standards. I used to think they ran things, and now that I work for the state, no offense to my federal partners, but the states run a lot of the programs, you know, and so maintaining those relationships, maintaining that trust with all the different stakeholders is incredibly important for all of us in public health.
Excellent. So I think, and this kind of come up, so I'm going to use this as a bit of a transition point, but I think overarchingly, when we think about kind of zoonotic transmission and all the different things that we're putting in here for infection control and for prevention, it's really trying to make sure that we understand the risk of transmission to our workers, the understanding of the risk to our wider population, and trying to prevent that transmission into those environments while also stopping it in the livestock that's there. And so as we start to look at understanding the risk to our wider population, we've seen a lot of technological changes in the last few years and how we start to understand what is circulating. And for every one of us in this room, we lived through the SARS-CoV-2 pandemic. It changed the way we think about genomics, diagnostics. We look at now, talk about circulating variants and things like Omicron, which before that timeframe, we used kind of those characterizations. We didn't use strain resolution information to talk about how these pathogens are emerging. And one of the big pieces that's come out of this H5N1, and I got to the pleasure of being a part of a large team that detected H5N1 in wastewater, is that's a marker of what's going on in and around our communities. And for those of you who are in here for lunch, you saw the video discussing some of the efforts that we have. But there's a lot of kind of push now towards using these markers of what's going on. We've talked about the challenges in diagnosing and even detecting H5N1. Even now, many of the clinical diagnostics just will identify as non-typable influenza A. So we have these other mechanisms that we can then use as a part of our public health kind of repertoire of tools to address these emerging challenges and these emerging pathogens, to understand what's in and around our farms, what's in and around our population, what's in and around our cities. But it brings up other kind of new and emerging questions. And so this one, Mr. Davis, I'm going to bring you in on is when we start thinking about wastewater and pathogens that are in there, that is a part of our water sources, particularly in parts of Texas where they have enclosed systems where our water is recycled and brought back to our population. How do we make sure, and what are the challenges in making sure that our water quality is as good as it can be across the state?
Yeah, so as you've mentioned, there are a great number of challenges. I'm from Utah originally. And have been in Texas. I moved here 2 weeks before the pandemic started. So that was an interesting start to public health here in Texas. But one of the biggest challenges is that Texas is so big geographically, the number of people here. Going from a place with 26 counties to a place with 250 some odd counties is very challenging. So in addition to that, the size of the farms is something that can add additional challenges as well. And there are thousands of them across the state with both animal and plants and foodstuffs. For me, though, the main challenge from my EPI perspective is that water can so easily be contaminated. And it can be contaminated with things like bacteria, such as Salmonella or Listeria, as well as parasites like Cyclospora and Cryptosporidium. And we do a lot of whole genome sequencing with the bacterial diseases. And the new technology that's only been going around for the past couple of years is the CDC is doing partial whole genome sequencing with Cyclospora and Cryptosporidium. So that's been exciting. And then we have also been working on doing wastewater surveillance with some of the enteric diseases. In Texas, every year we have between 15 and 20,000 cases of enteric diseases that are reported, but as with sort of all of public health, that is not the actual number of cases like y'all were talking about before. So there are potentially hundreds of thousands. So that adds some additional challenges as well. And then what causes a lot of the foodborne illness outbreaks, not just in Texas, but nationally and worldwide, is having runoff that is contaminated from the livestock that can seep into the water that is used for the leafy greens. So that has been a historical problem and continues to be. And it's rain. Like you can't control it other than trying to separate the farms physically, but there sometimes isn't enough grow space for that. So that is one of the other major challenges. And then lastly, what I wanted to mention as far as challenges go is that once something is contaminated, especially with some sort of a bacteria, it can be extremely challenging, if not impossible, to get rid of. There have been a couple of different outbreaks reported of salmonella that tested positive, and we had the same PFG pattern that showed up again 10 years later. So it is extremely difficult to try and get rid of that. And then one of the other issues that we have been seeing a lot of issues with has been harmful algal blooms. And so that's something we are always trying to keep an eye on as well.
So how do you you mentioned that we sometimes have runoff due to rain. It's largely unavoidable, but I know there are things like sluice ponds and other situations that are very large biological control mechanisms within our agricultural facilities. How else do agricultural facilities kind of interface and engage with our water safety and water control populations?
Yeah, so some more about the water treatment portion of that is that there are a variety of different types of treatment that you can do. It's never a one size fits all, but there are multiple things such as filtering, desalination. You can do UV sterilization, reverse osmosis, or sometimes some chemical treatment. And what is unfortunate, though, is all of that can be expensive. And since it's not a one-size-fits-all, if you're using UV sterilization, that doesn't necessarily mean that it's going to get everything out. So you need to often use these in conjunction with each other. Yeah.
Excellent. Thank you. So I think at this point, I've given you about 35 minutes to think of all your hardest questions. So I would like to open this up to the audience, and then Beth Ann, let us know if you have anything from the chat. But what questions do you all have for our panel today? Not everybody all at once.
Got one here.
Wait for the microphone.
Do you know how common is the consumption of unpasteurized dairy products in Texas, and has it been linked to disease?
And
In
the last part of
Texas.
your question, I heard how
And-
common is raw milk in Texas
And how has it been linked to outbreaks of disease in the state of Texas?
yes, it has been linked to outbreaks. We have about 50 some odd dairies, raw dairies that are licensed in Texas that has to be sold directly to the consumer with a label that says it's not been pasteurized. That's what the state law allows. There's quite a variety of state laws across the U.S. when dealing with raw milk. It's interesting, just this year, the FDA and those of us in public health celebrated 100 years of the pasteurized milk ordinance. So pasteurization in milk, 100 years, it's been incredibly effective. Thinking back, that's hard math, but 1924, brucellosis was very common in dairy herds. Tuberculosis was very common in dairy herds, as well as the other pathogens that we still have often residing in cows, E. coli, 0157, H7, Salmonella, Listeria, Yersinia. We still can get those in dairy products, and pasteurization is effective at mitigating those risks. So it's an interesting sort of tension there between a public health intervention that's been incredibly successful at preventing disease transmission through dairy products, but then some customers wanting to have access to the raw products. So there is some of that in Texas. Yeah, it's with everything in public health, you can't get very far without getting into risk assessment, weighing the risk mitigation. And in Texas, being a home rule state, so we think generally we legislate in Texas with the smallest entity that can, a municipality or a county. If they want to regulate, they do. And if not, then it falls back to the state level. Texas tends to lean in some respects to let the buyer beware, let them make the decision. So if they want raw milk products and they could be informed with a label, that's the situation we have. It does kind of tie to H5N1. The cats, anecdotally on the farms, they, you know, a lot of times cats are drinking milk, raw milk on the dairy. We don't know if that's how they got exposed, but the cats, as Dr. Abdul said, they just disappeared on some of the farms. We had a lot of wild cats around, now they're gone. And some that they saw with signs. We don't know if they got it by ingesting raw milk. Mice have been infected by drinking raw milk experimentally. If it's a very interesting disease, and this ties to I think the question that we got online in the last panel was spread of H5N1, those sorts of things. It's in over 100 different species of birds. I quit counting on the list of birds. Every bird you can imagine, an enormous number of mammals, bears, seals, sea lions, skunks, cats, you know, on and on and on. Mammals, mice have been infected by drinking milk. You know, if you want to be the first one to drink raw milk with H5N1, you know, maybe you could be written up in a paper, but it's definitely a potential. Over.
Can I add though? So back in 2015, while we were doing some work on tuberculosis among dairy workers, one of the aims that we had was to ask self-reported behaviors, both at work and at home. And one of them was, do you take unpasteurized milk home? And this was in one county with 300 workers, and almost a third said yes. And this is published work. We haven't repeated that, but this was back in 2016. No.
I do have a couple of online questions, if that's okay. So I'm just going to combine a few of these questions. Great questions. First is looking at producers, homesteading, small family farms, as these things are, you know, kind of, you know, more in popularity, et cetera. Sort of how, you know, what are the ideas around outreach that's being done kind of to spread awareness amongst the public, especially around health for flocks and livestock, as well as trying to get herds tested, how to work with producers to make sure that herds are getting tested early to avoid problems. That's the first question.
Can we break that down? Just, and correct me if I'm misunderstanding, Beth Ann, but can we break that down into kind of communication and awareness, and then also access to testing and promotion of testing? Is that a fair split?
Read my mind. Yes, that's
Perfect.
exactly it.
So let's start with kind of the communication and just making sure people are aware in these smaller farm facilities of what's circulating in and around them.
So when you say small farms, are we talking about like our backyard farms or just smaller scale operations? Because those are different, in Panhandle at least, because we have facilities that house thousands upon thousands upon thousands of cattle. Then we have our backyard flocks that may have maybe 10 cattle or even poultry. There was a backyard flock that came down with HPAI. They had about 265 birds, various birds. There were peacocks there as well. And ducks, grackles. Well, the grackles weren't theirs, but the grackles were hanging around, and we figured that's how HPAI was introduced. And so educating people, or at least having the educational material, is one thing. Getting it to the population in the Panhandle that have these birds or have the backyard operation is very difficult. They're not very trustworthy. They're not trusting of people coming to their property if they don't know who you are. So there was a joint effort between DSHS Zoonosis and Animal Health Commission with that backyard poultry facility operation, where the flock was depopulated because the animals were literally dying 5 to 10 a day. And so when it comes to HPAI, it's just more humane to depopulate rather than to let them suffer and die painful, slow death. And we went out from house to house to house to ask, do you have any birds? Or did you have birds and did they die? And then we gave them educational material in English and Spanish in regards to what's HPAI, because it was diagnosed in the area, how you protect yourself, how you protect your family, and if something happens, who do you call? And it was very hard. First and foremost, everyone spoke Spanish. So, and between the four of us that were out there, I was the only one that spoke Spanish. So that was like, woohoo. And then, because that was the thing, when we walked up to the door, they won't open. You knock, you'll see them peeping through the window. So you know they're there, but they're not opening the doors to speak to anyone. So we'll leave the information at their door. For those that didn't want to speak, as soon as you start speaking to them in their mother language, then they were more willing to start having a discussion with you. So that's it. There's barriers in getting this information out there to the demographic that we're talking about, right? They may have social media. I choose not to, so I don't have social media, but I get my news from other people. And so when you consider how are they getting the information to them, is it going to be social media? Is it going to be on the radio? Is it going to be well, newspaper, I don't know if they exist anymore, but let's say newspapers, or maybe something in the grocery store, for instance, like where are they getting the information? So we're trying to figure out how do we get this educational material out to the population that needs to hear it more. And that's been a challenge. It's always been a challenge, but with H5N1, it's bigger challenge because of the inaccessibility to the farms. And Anabel touched on it, and so did Dr. Stevenson here. Fear. I have never seen so much fear bubbled. Well, okay, there's COVID, but I mean in the animal industry, I have never seen so much fear fester and ooze like an abscess, all in one setting. There was fear on every aspect, every side, every component when this outbreak in cattle started. There was fear on the human side, what's going to happen if it becomes human to human transmission, or even if it doesn't, if we have a person that gets infected from what we've seen in Asia, people die from HPAI in Asia. What if that starts happening here? On the animal side, all these animals are sick before we had the diagnosis. What do? How do you treat them? It's only supportive care. How much is that going to cost? Are they going to recover? Are they going to get back to their production? Like free infection? We still have a lot of those questions without a solid answer. From the producer standpoint, are they going to treat my cattle how they treat the poultry industry? When we have HPAI in a poultry industry, I told you all already, it's depopulation. All of these birds are going to be culled. Are they going to cull all the cattle? They didn't know. So there was a lot of reluctance in working with the veterinarians or even working with us to do anything because of fear. There was just fear everywhere, and it was suffocating, honestly. So I hope I answered that person question. I'm not sure.
Yes. A lot of effort with flyers in different languages to get especially information about the disease and PPE, those sorts of things, personal protective equipment.
Yep, and we worked with Anabel and
Yes.
TEPHI, Leah.
yeah, we
Where's
worked
Leah?
with TEPHI to
Matt,
develop
yeah.
a really beautiful employee poster. Not,
We should have brought one.
yeah, we should have.
I will add,
Next year
so the two best ways to communicate with workers, and this is, we published a total worker health study a year ago, and that is WhatsApp and Facebook
WhatsApp.
are the two avenues. And then
Mhm.
as far as Quiche, that is a Guatemalan language that is spoken by some of the workers, there are different dialects, and it just became a written and alphabetized language a couple years back. So the best thing to do with that are infographics, no audio, lots of pictures, lots of bright things.
Mhm.
So yeah, tons of good strategies to use.
And that's what we did with that poster. We had it was written out in English and Spanish, but infographics. So with the hope that they'll understand the message that we were trying to portray to them, that we're trying to give to them. So, but we work with was it Sembrando Sueño? Who was it?
Yeah, Sembrando
Yeah.
Sueño out of Family Support Services in
Mhm.
Amarillo.
And we gave them about 500 posters to distribute throughout Region 1, since they had access to the dairies or employees and we did not.
Also, Texas Department of Emergency Management made available some free personal protective equipment, masks and goggles that the dairy farms could avail themselves to.
I know H5N1 has kind of been the topic that's dominated a lot of our conversation because it is the current emerging outbreak that we're talking about it from a zoonosis, and it's a large kind of challenge we're embracing. But many of our zoonotic diseases are better understood and better well known, and we have testing available for them. So if you're circulating kind of these resources to our smaller farms, these workers that are specifically there, do you include resources on the available testing and how to access that?
There's free surveillance testing that's provided by the federal partners, money through the state. Again, intro into the National Animal Laboratory Health Network. And that's free if a farm wants to voluntarily participate in that.
Any questions from the audience?
In the back.
Hi, good afternoon. My name is Miriam and I'm from Houston Health Department. And so I had a couple questions. First one was, is there any research in pasteurization eliminating H5N1 in the milk supply that we buy? I know I attended an online conference, and at that time, this was months ago, and at that time, it was not really known if H5N1 was circulating in our milk supply and if that could pose a threat to the community. Has there been any update research on that?
Yes, there was anecdotal information early on that the pasteurization was effective in egg whites and egg products from H5N1 in the poultry flocks. And so we had that information early on. The U.S. Department or the Food and Drug Administration worked hand in hand with the U.S. Department of Agriculture Laboratory, Ag Research Service, to do a fairly prolonged study. They took retail samples and got an estimate of what the expected level of virus could be in the milk. So that is your first starting point. How many viruses do you need to destroy? And then they ran pasteurization. They ran inoculated dairy products through a typical pasteurization process, and it was incredibly effective. So the pasteurized products are safe.
Okay, great. Good to know.
And then they also, after pasteurization, with viruses, you can detect the viral genetics, in this case RNA with PCR, but the viruses are inactive. And so that's one of the challenges, even with wastewater. Theoretically, pasteurized dairy products might go down the drain. We might get a blip on an H5N1 and sequence it in the wastewater, but it's viral genetic material, not viable virus. In this case, with the dairy products after pasteurization, they inoculated, and you have to pass it through 2 passages of embryonated chicken eggs. So you inoculate the first egg, you passage it into the second round of eggs, 3 or 4 days each. And if you don't recover the virus, then that's another way to verify that you didn't have viable virus. And so pasteurization is effective on both counts.
Okay, good to know. My second.
Very good to know.
Yes.
It'd be a whole different world potentially if it were surviving pasteurization.
My last question's in regards to the raw dairy products y'all guys mentioned earlier. Are there any outreach programs in particular for raw dairy product farms in terms of dealing with H5N1? For example, more routine testing of their dairy products?
Yes, the raw dairy producers in the vicinity where we have known counties that had affected herds in the state of Texas. We took a ring of all the adjoining counties, and any of those raw dairies, farms in those counties may have surveillance testing, and they've all been negative in those areas. So, and also just in terms of information, again, we don't have a direct case of some human being coming infected by raw milk. We do know that it's one of the most likely ways to culture or find the virus in a dairy cow. It is shed in the milk in high levels. If a cow is affected such that you can see that the milk is affected, that milk doesn't go into the food supply. That's always standard even before H5N1. But as Dr. Abdul said, the milk coming out of these affected cows is very small amount and very abnormal. So that milk's not going into the system. But there could be some subclinical cows that either before they become clinical, they might be shedding virus in the milk, or after they've recovered, they might still be shedding some intermittently from time to time. In that case, pasteurization is effective. But again, all of these scenarios, we don't have direct evidence of a human becoming infected, but from raw milk that carries the virus. The CDC has been at the forefront of this from the get-go. They constantly have warnings about the potential risks of drinking raw milk, and that's been highlighted in the face of this outbreak with H5N1.
Hi, my name is Cherissa Abdul-Hamid. I work for the Department of State Health Services as the Office of Border Health Epidemiologist. And I was wondering if you all have had any programs that are aimed at youth through Future Farmers of America, or any other kind of youth programs if there are, children that are accompanying their parents as migrant workers. Because I know there are some studies that have shown that approaching the children and educating the children can be a great way to also educate their parents and the adults in their lives.
So not particularly in the dairy industry because it's non-seasonal. So we don't see a lot of migrant farm worker families, but we do see some youth. We've had a leadership and management training in the past where they would take some homework for stay home, and their children would help them at most times because we were the ones, on the phone trying to help them out. That's a great idea, but I think for the dairy industry, because of the nature of its non-seasonality, it's a little bit harder to access the youth.
We have about 1 minute. Do we have any quick questions from the chat?
I do have a couple of more questions. I don't know how quick they are. Question has come up. Oh, this question came up a couple of times. Liver fluke. Can you hear me?
Liver fluke.
Yes. Is anything being done? Any information on liver fluke? And then also about if the Missouri health worker being tested today for H5N1 comes up positive, indicating human-to-human transmission, will things change? Will anything be done differently? How is that considered as a trigger for Texas?
Yeah, the Missouri case has been confirmed, but still no confirmation of any contact with animals. I think someone lived in close contact with the person who was positive, had maybe an influenza-like illness, had an illness previously, but they still have not done the results of antibodies, residual antibodies, to see if that person may also have been infected with H5N1. So that one's a little bit of an enigma. This disease is it is a head scratcher in a lot of ways. We just ought to admit that we don't understand everything there is to know about it. I guess here's one takeaway for all of us in public health. This recently came to California. They had 3 dairy herds affected. The chief of their state health department and ag department said they felt like they were well prepared to handle H5N1. Last Thursday, there were 17 farms positive. This Monday, there were 34 farms positive. So I'm going to take that out of my lexicon to say we're well prepared for any emerging disease. We can talk about what we are doing to be prepared, but it's a challenging disease.
I want to thank our panelists one more time for an excellent discussion.
Yes, you can. If you like. So, thank you, Livestock and Food Safety Panel. What? Share my screen. Okay. Shoot. Share screen 2. Share. Thank you for the reminder, Dana. That was an important conversation. Let's take a short 15-minute break, but please be back in your seats with your raffle tickets in hand at 1:45 sharp. Please. Thank you.